Okay, so I'm going to take a little bit of a different approach to this journal. Rather than you sitting and looking at the camera and watching me for however long talk, I'm going to narrate what I want to talk about, and then I'm going to show you different pictures, kind of. I've taken some pictures of the hospital here, and then maybe some other pictures of different things, kind of orchestrating what I'm saying. So this one's on communication. So the word communication is defined as an act or instance of transmitting or a verbal or written message, as well as a process by which information is exchanged between individuals through a common system of symbols, signs, or behaviors. So, pretty much anything we do between ourselves and another person is considered communication. When working in a hospital, communication is obviously one of the most critical aspects that everyone needs to ensure that they follow, whether it be a doctor, nurse, the people that are there with clients. It's really important that communication is between professionals as well as clients to ensure their survival. Just really, really important. In 2007, Dal Saga and his colleagues stated that the world of healthcare is increasingly complex, technology-intensive, and subspecialized. This has created the need for medicine, nursing, and other health professions to come together as an effective team with exceptionally high levels of mutual respect and effective communication. I really saw this in a situation a couple weeks ago. It was kind of a small situation that we thought to begin with, and then it turned out to be quite a big one. A gentleman came in with some chest pain. We followed the usual protocol. Things then began to get worse rather quickly. So there were nurses and all kinds of doctors all trying to work with him in different aspects and ensuring that he was going to be okay. He started to get better, and then they brought in the medevacs to take him down to Edmonton, and things got worse again. So then, before they could transport him, they needed to intubate him. So then they called in the anesthetist. There were other doctors on call, nurses, the medevac guys were there, the paramedics were there. Everybody was kind of there, all trying to make this person better. But there was communication needed between professions as well as within the professions to ensure that he got the quality care that he needed, because otherwise, he couldn't be shipped down until he was better, more stable, because it was tough. Everybody working together and ensuring that he was going to be stable. So it was really good to see how the nurses and the doctors and everybody communicated with each other regarding his situation, where he was at, his vital signs, that kind of thing, to ensure that he could be sent down to Edmonton. And as far as I know, he survived and is actually back in town now. So just the communication there was huge. It was really neat for me to see how they worked with each other and how they really ensured that the family was hearing everything they needed to hear, and it was just going quite smoothly. It was really good, very comforting to know that communication was top priority. Another case that is kind of slightly different, but also in the same, involves a nurse and a patient. People are in the hospital to get better, so ensuring that their feelings and concerns are heard is very important, as well as getting across, their medical standpoint, what they're there for. Patients want to be heard, and it's very important to allow them to talk. The issues they're having, it can be therapeutic for them to talk to you. So, in 2009, Hayden advised that taking the time to listen to one's patient's stories, their achievements, hopes, and fears can help one give them better nursing care. Among other things, oral storytelling is powerful because it involves not only the story, but the act of telling, which together create the greatest impact. Once told, the teller can let go of the story, giving up control and letting the listener decide what to do. So basically, it just lets them elaborate on what they're feeling, lets you write it all down, discuss with the doctor, kind of see if there's an underlying issue, if there's, a consult or something that needs to be done for them. This was seen firsthand with me when a patient came in with an issue that he needed dealt with, but after we sat down and talked with him for a few minutes, we realized that there were many other underlying issues that he had that were affecting this person. So kind of like, someone with an anxiety disorder may have a number of other issues that may stem as far back as their childhood, and them taking the time to talk to you and allowing them to tell the story may really relieve their feelings and maybe even help the anxiety a little bit. So it's really important to ensure that these people get a chance to talk to you and communicate with you in more ways than maybe they're showing when they first come in. Just kind of give them a better feeling of you listening, and that you really care about their feelings and what they're going through, and things like this. So hospitals are and the people that work within them are there for the people and their health. So ensuring that people are looked after in a way that helps them is essential in the communication within disciplines within the hospital, as well as communicating with the patients and their families to ensure the person gets the best health care possible, because we want everybody to be healthy, and in order to keep a patient healthy and keep them on the road to recovery and getting back home, it's essential that all disciplines talk to each other, communicate in ways that help the patient as well as their families. And communication is a huge thing that everybody really needs to look at closely and ensure that they're doing it well. Not necessarily just doing it, but you need to do it well. Communication, just can't say how important communication is. So yeah, there's my journal on communication. I'll do another one on critical thinking in a few weeks.